Hi, my name is Gemma Smith, and today I am going to talk with you about a major issue in the healthcare field right now, and that is perverse incentives specifically for early elective deliveries. So, what are early elective deliveries? So, these are induced or cesarean deliveries between 37 and 39 weeks of gestation, and these are not medically necessary. So, if they're not medically necessary, why would you want one? So a mother would want them for the convenience of it and if they're intolerable of unpredictability. So for instance, let's say you are pregnant around Christmas time and you really don't want to be having your baby on Christmas. So instead you would choose to have it, a couple of days before that, so then you could be home on Christmas, spending it with your family instead. And then doctors would want them for better control of their schedules, eliminating middle of the night deliveries, and ensuring that they're the ones delivering the babies, not a partner, just in case they were busy with another delivery at the time or on vacation or something like that. So why are these so dangerous? So they're dangerous for babies because infant mortality is 50% higher for babies born between 37 and 38 weeks compared to 39 and 40 weeks. Babies can suffer breathing, feeding, and developmental problems. These are also extremely dangerous for the mother. So if you choose to have a C-section as your method of delivery, this is a major abdominal surgery. This can lead to infection, hemorrhaging, complications from anesthesia, and it can also complicate future pregnancies by a ruptured uterus, hemorrhaging, and possibly having to have an emergency hysterectomy. And if you choose to have induction as your delivery method, this can lead to a failed induction, which would in turn lead to a C-section, which is dangerous. The medicine that they induce you with can lower your heart rate. It can lead to infection. It can lead to a uterine rupture, and it can also lead to excessive bleeding after delivery that wasn't supposed to happen. So if these types of deliveries are if they're so dangerous, why are hospitals encouraging them? So first of all, they're encouraging them because they generate admissions to NICUs, and NICUs are profit centers for hospitals. Doctors and hospitals, they're rewarded for more services, not necessarily better services. So, if babies are being born with all these complications, they're getting immediate testing, and these tests are expensive, all these procedures, and these are reimbursed at higher rates by insurers. So what can be done about all of this? First of all, stop giving doctors and hospitals incentives for early deliveries. These are extremely unethical and shouldn't be allowed at all. Instead, you should be rewarding doctors and hospitals for having healthy moms and babies that get to go home after birth, not being stuck at the hospital in the NICU. Also, there needs to be education. Doctors need to be educating their patients on why they do not need to be having early deliveries and instead should be letting their bodies choose when to have the baby instead. So just a quick personal story that I have on this topic is I have a 2-year-old. And so when I was pregnant with him, my doctor offered to me the choice to have an early delivery at, around 37, 38 weeks. And I thought about it after he told me, but thinking on it, I just couldn't come to a good conclusion on why it would be necessary other than just for being able to just choose when I was going to have my son. And this just did not make any sense to me the more I thought about it. Women have been having babies naturally for ever since we've been around. And so it just made no sense to me to bring my child into this world, not until he was ready. So instead, I just chose to have my baby when it was time, and it turned out wonderful. And I just don't think that hospitals and doctors need to be encouraging these, especially when they are so dangerous. So I hope that all this information will help you see why early elective deliveries shouldn't be happening and instead they need to be discouraged. Thank you for listening.